All right, there was an act passed in the last legislature that created the Alabama Drug Abuse Task Force, and its purpose is to bring together many state agencies, entities, private entities, associations, law enforcement, private groups, treatment, and bring those folks together to comprehensively look at drug abuse, addiction, treatment, enforcement, deterrence, punishment, all the things that we do in Alabama from that whole state approach, the 30,000-foot level, if you indulge me on that, because I think that we've never really looked at it comprehensively from stem to stern. And when we have there may be a program in one part of the state that does a really good program on education, but it doesn't transcend the state. They don't know about it in another part of the state, or it's not coordinated with law enforcement or the actual needs of the community. It's an effective program, but that community may be, the drug that's plaguing them may be not the one that's focused in that treatment program. So we want to look at and assess the state from a total perspective. What's the gang influence? What's the trafficking influence? What are the drugs of choice that are affecting young people and communities? College campuses face different issues than regular communities do. So we want to look at it comprehensively, assess the problem, and then let the legislature know in a report 10 days into the session what the issues are and what the needs are, and try to get a comprehensive approach into the whole view of drug abuse and addiction in Alabama.
What are you finding regarding the relationship between, prescription medication abuse versus, your illegal narcotics?
Prescription abuse is one of the most abused drugs that we have in the state, if not the most. It's reflected in our statistics in the forensic sciences, the submitted drugs for testing. It's a severe gateway drug. We've become a society where we treat everything with a pill, and because we do that, then the public, we get desensitized to drugs and to putting those kind of things in our body. So drug abuse, Adderall abuse on college campuses is rampant right now, high schools, and the selling of those, they're going for $25, $30 a piece now. But prescription drug abuse is a key problem in Alabama, but so is meth and cocaine and crack and like I said, methamphetamine and all those type drugs. The synthetics are coming in droves, and the trouble is narcotic officers, you fight methamphetamine differently than you fight crack, than you do fight synthetics or prescription drugs. They're different genres, so they're very difficult to battle against, but also to educate and to prevent. And so instead of having the shotgun blast like we've had for my whole career in the past, is to look at it comprehensively and say, here's what the problems are, now how can we address them for the whole state, for areas that may not being addressed now.
With your report being due 10 days into the session, is that enough time for legislators to really draft comprehensive legislation to try and tackle these problems?
This is a journey. It's not a sprint, and I think that we're going to give them an accurate report of what this looks like and what we're faced with. And we're going to have some recommendations initially, but we'll be back here next year, and this group will meet again and again and again and develop strategies. So we're not going to give them a report and walk away. It's not a feel-good meeting. It's not something we're going to come together and talk about it, pat ourselves on the back, and go home. This group is getting back together, and there's buy-in. One thing I think is critical that everybody in this group has realized: we're all joined by one thing, and that's addiction and drug abuse. Everybody's budgets are affected. DHR, parents who are addicted to drugs, they're brought into those families. DHR is Department of Corrections, obviously, law enforcement, but every state agency has some connection to controlled substances, public health, mental health. They're all tied in. So we've always looked at it in the vacuum of our own agencies and our own problems. That within mental health or within the DA's association or within corrections, we'll solve it. And you never will. There's buy-in. Everybody's looked at this and said, okay, we're linked. Now how do we do it? And so I think we'll get something good out of this, I hope.
Is this one of those deals where it's not saying, hey, we need more money, but we're just spending our money that we have smarter because we have a specific plan?
Exactly. When this task force was created, it was created without a budget. And we didn't ask for any money. We're here, everybody's here on their own dime, and we're here because of the problem. We're looking at this, and we're going to try to develop answers and give that to the legislature and say it may be policy issues, there may be some budgetary, some resources that need to be addressed. Certainly, everybody can use more money, but there's some things we can do just to coordinate. I mean, if there's a drug prevention program in an area, then the narcotic officers who know what the drugs are in that area need to be part of that conversation. conversation about that prevention program. They just need to talk, and they don't. Drug task forces around the state aren't linked in any way. They work independent. They're linked through their own association, but they're not linked through any type of official network. And so we need to get a handle on that and work on it.
I have a list of the drug task force members. It's a very long list. I don't need you to
Sure.
name them out. Just give me a roundabout number of how many organizations are involved in the drug task.
Right now, there's about 25 organizations, not including the people, the college students and high school students we've invited. Some will speak today. But I've been contacted by the Medical Association, the Medical Examiners Association, Hospital Association. They want to be part of this. I've had people calling saying, "Hey, I'm not on your list. Can I be a part of it?" Which is pretty encouraging that we've had folks call and say, "I want to be part of this." So hopefully it'll be positive. It's a large group, but you've got to have it big.
We've got a reporter that's doing a specific report on the drug fentanyl. Are you familiar with that drug?
Fentanyl, yeah, it's a depressant, I believe.
Right, it's actually used in treatment of cancer patients, as I understand it, for a patch. Have you guys sort of seen any kind of trends regarding that kind of use?
You've had some overdoses, fentanyl patches, where they put too many and they die. They'll put, they'll extract the drug from the patches. A lot of different methods, a lot of different ways. Those type of prescription drug abuses are rampant, and that's what we've got to get a handle on. I mean, there's just too many ways to get hold of, 90 Loratabs, and then get it 90 more someplace else the next week, and it's sold on the streets. And whether it's fentanyl patches or whether it's Adderall or anything else, if it gives some type of higher stimulant or depressant effect, and it's something that appeals to you, and you're addicted, a person's addictive behavior, they're going to abuse it. And we've got to educate, because a lot of times they don't realize until they're into the addiction that it's got a hold of them.
How do you get a hold of something like a cancer drug? I mean, how does that, because that's controlled, so how does that reach the street?
A lot of times people sell them. I mean, Adderall is, if a kid needs Adderall and he only uses on test days and doesn't use it on weekends, that gives him 10 extra a week to sell at $25 a piece. So fentanyl patches, somebody passes away, I think the AG's got a drug take-back program that they're implementing that's helpful. Somebody passes away, the drugs are in the cabinet, they stay there, and they get sold. I've even heard of people that scour the obituaries and go and pose as a friend of the deceased, and excuse themselves to the bathroom to go and scour for drugs from the person who passed away. I mean, it's when addiction takes over, you don't want God, sex, home, your kids, food, you just want that next high. And what we've done as a state is waited till somebody is wrapped up in that, or either they're selling the dope, and if they do that, they might as well be committing murder. If you're a trafficker or a drug seller, you're a murderer. But we wait till that gets hold of them, then we address it. We don't do anything comprehensively on the front end to say don't do it, other than a program here or there, some Red Ribbon Week, we do something like that, but nothing comprehensively. So that's what we hope to kind of come from this. All right, appreciate it. Thanks, man. Thank you. Thanks. Talk fast.